I love this question. What's the difference between, say, a child's step stool and the squatty potty? Let's think about what the goal of the squatty potty is: to get your knees higher than your hips, about a 35-degree angle here. And what that does is it relaxes the pelvic floor muscles and it takes the kink out of the rectum so everything opens up. So it's great to get your feet apart here. And I've used a step stool similar to this one, and it does a great job, but I find sometimes that I feel kind of scrunched here and I can't get my feet apart. So this is definitely better than nothing. However, check and see and compare. Like this, it would be too low. It's not a high enough angle here, so it would be at a disadvantage. However, there are times like when I've traveled, when you gotta be resourceful. So I grab 2 rolls of toilet paper, and hey, that's better than nothing, or grabbing a trash can and flipping it over. Square trash cans work better, and if they're a hard plastic, it's great. I was in one hotel that truly, I'm like, they must have designed that with the mind of a squatty potty, because it was perfect, it was rectangle, and it worked just great in a bind. So those are a couple of thoughts about different step stools, but something is better than nothing. So go for the step stool, and when you do purchase the squatty potty, you also have different options for colors, wood, and travel, where you can fold it up in case you're going to the hospital or you're going on a trip and you can't think about traveling without your squatty potty. I love this question from Pirelli 913. How often are either the external and or internal exams conducted, only the first visit, or are there subsequent visits that require it? Great question about pelvic floor physical therapy. Let's talk about the what and the why behind this. When you see a pelvic floor physical therapist, we focus in the pelvic area. But I'm gonna also ask you lots of questions about what's been going on, your symptoms, how long, what makes it worse, what have you already tried? And after all of that, I'll take a look at your back, how you move, how you bend, your strength, and then it's time to assess the pelvic floor. I only do this if you give me permission. It's a consent thing so that you feel comfortable, and I tell you what's gonna happen. So typically what I explain to women is, okay, I'm gonna go ahead and step out of the room right now. I need you to undress from the waist down, cover up with this sheet, and then I'll be back in. I use my model to explain what I'm doing. I'm working on and assessing the pelvic floor muscles. So this is your pelvic girdle, and these are your pelvic floor muscles. Typically everybody says, oh, it's my vagina, and that's actually internal work. What we see on the outside is the vulva. So I'm gonna palpate there along with your abdominal area, always asking you, is this okay? Are you comfortable with this? You let me know if it's uncomfortable. If we find any pain, then often I will treat that as we're working through it. So I'll look at externally, and then I'll say, okay, I'm gonna put gloves and gel on my finger. Would it be okay if I assess the muscles internally, vaginally? So again, I'm not using a speculum or anything like that, seeing how the vaginal opening is and the muscles and the tissues inside. If you feel uncomfortable with that, we can always do an evaluation fully clothed. We don't have to do this. If there's been sexual trauma in the past and you just do not feel comfortable, let your PT know, because again, we can make adjustments. We totally understand that, and that sometimes it's traumatic and sometimes you don't feel comfortable on that first visit doing all of this. In the subsequent visits, then we assess this side. If we're dealing with some muscle tension, we may work on the internal work each visit. It may be that once you understand your pelvic floor contraction, I might do biofeedback, which means we can just use electrodes on the outside, and that records and you can see the muscle activity on a computer screen, and then you pull your clothes back up and you do that as you're doing the exercises. It may be that you're up doing activities like stepping up or jumping on a trampoline, those types of things with the pelvic floor exercises where you'd be clothed. So again, it just depends what the reason that you're coming to see the pelvic floor physical therapist is and what's the goal is. So we cater the treatment to you. I make sure that as I'm explaining the treatment, you know what to expect and what to come forward. A lot of times women will say, oh, I'm on my period, I don't want to do an internal assessment, and that's fine. If you prefer to wait another week, we can. However, being on your period does not prevent us from doing an internal assessment. The other thing is when you're pregnant, we can do internal assessments of the pelvic floor muscles, especially if we're dealing with pelvic pain or we're preparing for a delivery. But we always want to get the doctor's approval, your OBGYN, or your midwife before we do any internal work in pregnancy. We can do internal work in the second and third trimester as long as there's no bleeding, it's not a high-risk pregnancy, and we get the doctor's approval. Postpartum, we also do internal work. We may also assess the pelvic floor internally after delivery, but we wait until you've seen your doctor and been released, that everything's healed, usually at about 6 weeks postpartum. So that's hopefully some information to help you know about the internal assessments, as well as we may do a rectal assessment, but again, that's not as common, but we walk you through that. The goal is so that you can achieve your goal of either not leaking, getting freedom from pain, moving, preparing for delivery, or recovering from a delivery. So again, working together with your pelvic floor PT is so important. We're here for you, and we want to make you comfortable through the process. Here's another great question from Mari MLB. Thank you for the tips. Can back pain be a normal symptom in early pregnancy, week 4 or 5? It can. Sometimes women start to have symptoms, and a couple of those causes could be hormone changes right away. Your body is starting to feel the changes. The other thing is you may be having some stress. Am I pregnant? Am I not? And it starts to surface as some muscle tension that you don't even realize that you may be having some discomfort. And you're like, what's going on? The other thing that happens if you had symptoms before your pregnancy, sometimes those kind of creep up. So wherever your weak spots are, you're like, ooh, now I really feel it. You're like, why am I having a back pain? It's not like I'm pulling, the belly's pulling me forward. Your uterus is growing even in those early days. And each day, a little bit different feeling is coming on. Again, keeping mobility is so important. Walking, doing some gentle stretches, but if ever there's pregnancy pain, know that it shouldn't be dismissed and just, that's normal in pregnancy. You want to talk to your doctor and you want to see a pelvic floor PT, because I want you to enjoy your pregnancy, be prepared for your delivery, and go into your delivery really strong. Seeing a pelvic floor physical therapist through your pregnancy can be so, so helpful. This is a great question from Ruana. Is pelvic pain sign of an ectopic pregnancy? What is an ectopic pregnancy? It's where the fertilized egg is attached outside of the uterus. Most of the time that happens in the fallopian tubes. Let me explain where that is. If this is the vaginal opening coming up here, this is the uterus. These are the ovaries here, and this area right here is the fallopian tube connecting the ovaries to the uterus. If the fertilized egg is implanted here, that's an ectopic pregnancy. Now, according to the ACOG, some of the symptoms of an ectopic pregnancy are bleeding, abdominal pain, or shoulder pain. Again, when you have symptoms that are abnormal, anytime you have the bleeding or pain that doesn't go away, contact your doctor, and then they can discuss this to include all of your other symptoms, may ask you to come in for a visit in the office, and then do a further assessment from there. However, you don't have to decide what the cause of the pain is. Just if you have a discomfort or pain, make sure that you reach out to your provider and then solve the problem from there. Also, continued pain can be addressed by a pelvic floor physical therapist, even early on in the pregnancy. Don't feel like you need to go through your pregnancy on your own. Here's a question from Melanie Hernandez. Is it round ligament pain if I feel pain when I walk? It's in the right abdominal area. So often round ligament pain gets blamed for a lot of pregnancy pain. So there could be a round ligament, which again, it's a ligament that comes from the uterus and is coming down. And as the uterus stretches, you can have this sharp pain. Often when you're standing up, going from sitting to standing, or when you cough and it's kind of a sharp movement. Another thing that could be causing it is a deep psoas muscle tightness, especially if it's when you're walking. A psoas is part of your hip flexor. So again, it's the muscle that's lifting the knee up, and that can get tight. As a pelvic floor PT, I'd assess everything and rule out where it is, what is the cause, and how is your mobility and your strength. It could also be coming from the pubic symphysis joint. Or you may have heard of SPD, symphysis pubic dysfunction. That's more discomfort like when you're standing on one foot. There can be some separation here or some laxity. Or if you take a big step, you have some discomfort or going upstairs. Those are some things that indicate that it could be coming from here. This is a bony area right here on the front. So again, go down from your belly button down, and when you hit the bone in front, that's a symphysis pubic joint. What you need to do is, again, discuss with your provider and your pelvic floor PT to see what is the best treatment for you.